Hey guys, it's Dr. Kumra. I want to answer a question I'm going to get asked every single time I do a new patient exam. How hard is it to take off the Invisalign Aligner? Guys, it is not hard at all. Of course, I've been doing this for a while, so I know how to do it, but here is a model that has an aligner on it. This is a model, so it's a little bit hard with angles and stuff. I will show you in the patient's mouth how to do this, but if you start at one end and then do the other side as well, this guy's pretty much off with ease. So here's some of the questions I get asked all the time. Is it going to be inconvenient to take this off at a lunch meeting? Honestly, no. I've seen people turn their head, do it at the side of the room, go to the restroom and do it. Please, whenever you do take these out, we give you a case. We give you a pretty cool case. It looks like a little makeup kit. I got my sticker on there. Guys, please use this thing. I can't tell you how many times patients call and say, I lost my aligner, what do I do? And we have to talk to you about fees, we have to talk to you about waiting time, we have to talk to you about how to manage the situation. Put it in the case and put it in your mouth when you're back ready to get using it again. Do not put it in a tissue and leave it on the side of your lunch, the side of the dinner table or anything like that. I promise you, a dog, waiter, somebody's gonna get to it and toss it. So yeah, that's basically it. Couple seconds, wash your hands of course. Couple seconds, pop the aligners out, put them in a case, slip them into your purse or pocket. When you're ready, rinse out, pop them back in. Treatment's easy. Call us if you need us, guys. I can't wait to meet you. Thanks.